Good morning. Welcome to another edition of Around the World News. My name is Benjamin Lopez and today is July 10th. And I will be giving you the top news of the day. At 11 a.m., the legal consultant for various pharmaceutical companies will be discussing why the companies must keep their patent law. The legal consultant, Jonathan Perez, will present his point of view towards the subject, while a representative of the people against the patent law will try to convince the people as to why the companies must stop applying the law or at least modify it. The patent law is considered as a problem that affects everyone's pocket. When a new drug is invented, the inventor gets a patent for 20 years, meaning that they are the only company that can produce the drug. If there is no competition for a single product, the company can sell the product at whichever price they like. From the company's point of view, they stand firm in that they must maintain the law in order to have enough money to invest to keep conducting research in different areas. Also, they need the money to be able to export their products. On the other hand, the AAP, the Association Against the Patents, keep pushing forward their main opposing view, the economic situation. Enrique Fryer, their representative, will try to impose that the law be adapted to the different regions. For example, in the job market of the third world. There, people don't have enough money to be able to buy medicines. And because of the patent law, there aren't any generic or bioequivalent medicines that will be less expensive. A big number of people have shown up to support the side they believe in. However we see it, the representatives of the pharmaceutical companies think that they should retain the patents because a drastic change in the patent law would affect the company's budget. We'll see what happens later on. Until then, stay tuned to this, your Channel 6 for the complete coverage. Live from San Juan, Puerto Rico. Have a good day.
For us, our number one priority is to provide people with effective, reliable, and above all, safe medical drugs for consumption. People's health, as I said before and now again, is our number one priority, and that's why investing widely in medical research is vital for us in order to reach the FDA standards and above all our standards. Now, after we have successfully created a new medical drug for our consumers, we have to go into the process of distributing this drug. During this stage, we analyze the drug and determine the price so it's as affordable as possible and as many people could buy it. Now for the issue before today about whether or not a pharmaceutical company should have a patent or not, which give the company the rights of regulating its own drug. We clearly can be with our position. We are in favor of the patents.
When does a human rights end? Isn't it a right to live? Why do we let companies decide who lives and who dies? Yes, fellow members, we let a company decide who can and who can't buy their medicines. We let them decide the future of our ill people. Medicine is a necessity. We're letting companies decide about the future. About our future. How can an HIV patient or someone who has had a simple cold survive without a drug? It's impossible. It's like putting a gun to their heads and hesitate before pulling the trigger. Because of companies, millions of children and adults die every year because they don't have the monetary power to afford the medicine cost. Here's the problem. When a company develops a new drug, with the research they make, they get a patent. With this patent, they have all the control to establish the price they want for their medicine, who they sell it to, how they produce it, and distribute it. And also, they are the only ones that can sell it. This means they have no competition. Without competitions, the price won't lower. The patents are established for a certain amount of time, but they have still effect on over the people. Because of patents, the pharmaceutical industries have become a monopoly. They have decided not to sell medicine to the poor because they have no profit in it. According to Katsatsky, only 13 from 1,393 drugs approved during 1995, 75, and 1999 are primarily for the poor people. Only 13. And we could question ourselves too. Are these companies interested in the life of the people or the profits? To give poor, why is it a problem to give poor people cheaper medicine? Companies could benefit from this because a new market will be established and new profits will come to the company. More people will buy medicine for that sake. Another solution for this problem with the patents is the traditional knowledge and international IP law. This law established, this proposition more likely, established that if knowledge is something that will benefit others, it's for others to use too. This means that if a company finds a new cure, everyone has this means that if a company finds a new cure, everyone has the opportunity to benefit from it. With this law, poor countries could create a biogeneric drugs from the brand names. And by this means, these drugs could be much more cheaper and many people will have the ability to buy them. The problem with these developing countries is that they do not have the monetary power to start developing infrastructures that handles the rights of buying knowledge and research. This means they have no ability to establish a drug market by themselves. But governments can do something about these patents. For example, we take India. In India, a law was established that lowered the price of the prescribed drugs. For example, the HIV drug in many countries costs about $50,000 per year. Only in India, it only costs about $200 per year. This is a reality. It's not impossible to lower the price of drugs. We could sell it to much more people. It's the responsibility of governments to care for their people and create laws that regulate the pharmaceutical industry, because they are becoming a monopoly and they are controlling the future of our ill people. Because of this, I say that we have to take down all the patents, and the knowledge acquired is for everyone, not for only the people, the rich people or the companies. It's for everyone to use. Thank you very much.
What really captured my attention was the words you used to describe the word patent. Power. The power of deciding the future of the ill people. The power of whether or not they can afford the drug or not. We certainly don't have this kind of power of deciding whether or not a person could afford or not a drug. But we assure you that we analyze our drugs in order to be as affordable as possible, and at the same time we could obtain some capital in order to maintain our company running and as well our medical research running. There are no major margins for profits here. We use them for all the essential needs. Just to bring some perspective to the matter, I will provide some numbers from the top pharmaceutical companies. These companies, which are the top revenue in the business, which is roughly $60 billion a year, only $10 billion a year are for profits, putting the other $50 billion for spending money in order to maintain the company running. In other terms, it is impossible to lower any more our drug prices. If we were to do so, it will result in the loss of the company and will eventually conclude in the closure of the company, which will put in stake all of the persons, because nobody will be able to obtain any medicines or even for investing in future medical drugs. Another very possible scenario, which will most certainly occur if the patents were to be eliminated or modified for that matter, it is the endorsement of new markets for the black market. A study conducted by the Al-Rafa Foundation, Dr. Ali Dawa, said that 37 to 50% of the existing drugs are already being smuggled in. This is about $32 billion a year worth of drugs. And now, imagine the same market, but with even more medical supplies and easier to obtain. This would eventually conclude in the closure of almost all, if not all, of the pharmaceutical companies. Now, for addressing the number of approved drugs, there is a reasonable explanation for this. The reason that only 1% of all the produced drugs are passed to the market is because the FDA did not approve of them, mainly because of the side effects that were too bad for a person. Now, for addressing the numbers of medical drugs approved, there is a reasonable explanation for that. The reason that only 1% of all the drugs produced are passed to the market is because of the FDA, which did not approve of them, mainly because of the side effects. If we were to pass these drugs without any test, people will suffer even more from the drugs from the disease itself. That is why it is vital to spend many years in research in order to make it as safe as possible for the consumer. And that summarizes. That's why it is so important that pharmaceutical companies have patents, because it helps maintain balance, and it also helps maintain the future of development drugs, and at the same time provide a price which is as affordable as possible. Thank you.